Yeah, welcome back. Very good afternoon. See, a few minutes back, we discussed the general indications of spider group. Okay, and you had a small break of 30 minutes. In case if you have any questions, any clarification, anything you want me to repeat, hmm? So all fine. Okay. So if things are fine, if you have no doubts related to the previous topic, I told you or I gave you a list of spiders we use in homeopathic materia medica. And in that, for a third year student, we have two very important spiders. Okay. And if you remember, I was talking to you about Theridion, that is one spider, and another very important spider which has a very limited information or sphere of action is Tarentula cubensis. So two spiders we'll explore in detail, and luckily I have used both Theridion and Tarentula cubensis in my clinical practice. So I'll just share a small case before we get into the details of Theridion. Now, one very important thing you have to remember, when you talk of spiders, is they're very hyper, I just told you. And very often, homeopaths use spider remedies for ADHD. With due respects, let's not comment if it is right or wrong, but they use with beautiful results. I had a case of a very small girl who had some behavioral issues. We did our analysis, we did evaluate her condition, and what came up was she was a child with behavioral issues, and mind had not developed to the extent of her age. It was not very proportionate. The development was not very proportionate to her age. Very hyper child, and I don't know. I have read in some books where they say when you have a tarantula child in your clinic, you need to be very cautious. As a doctor, you need to be very cautious because they might break or they might spoil your things. Fine, they might meddle with your phone, they might meddle with your laptops. I mean, one constitution, when they enter, you become very alert, and that constitution is tarantula. The moment they enter, you'll be looking more than the child, you will be looking at your valuables. How will I protect my laptop, or where is my mobile? You keep your mobile inside. Fine. So now this is one such child who had come, very restless child, very hyper child, and who had little delay in her development. Okay. Now one thing that I found in her, which was very peculiar, was she was extremely sensitive to noise, extremely sensitive to sound. Academically, she was behind. She was not able to follow the instructions. Okay. And any small sound, she immediately closes her ears. Now, this is a beautiful indication of Theridion. It's been almost 4 5 years. She was 4 5 years back. She was given Theridion, and there has been a consistent improvement in her behavior, in her academics. Her eye contact is much better. So Theridion, when you see a spider, a remedy indicated in your patient, and that patient is very sensitive to noise, please think of Theridion. This point I learned from my sir, Professor Vijay sir. So I have used it in my practice with beautiful results. So in future, If you
Sir, your voice is breaking, sir.
in future, if you yeah, let me see, must be some issues with the internet. Okay, in future, if you come across such patients, please do think of Theridion. Sai, is it clear now?
Yes, sir. Now it's
Yeah,
clear,
okay,
sir.
fine. Yeah, any problems, please do let me know. We'll look at the technical issues. Fine, okay. So we'll go ahead. So I was just sharing a small case of Theridion, which was used for a girl with, you know, behavioral issues and mind not being developed to the extent it had to develop. Okay, so with this small case we will look at what else Theridion has to offer for us. Okay, so Theridion, if you remember a few minutes back, I was trying to tell you that this is a remedy which lives on orange trees, and that's why it's got a name, orange spider. Okay, so they say the venom of this particular spider can cause a lot of neurological issues. It can cause anxiety, it can cause coldness, and it can also cause loss of consciousness. So this is what they have observed, and the credit for proving this particular remedy goes to Dr. Herring, and it was introduced into homeopathy in the year 1832. This is the gist of the entire slide. So we will get into the serious part of Theridion discussion. Which part Theridion acts? See now, please do keep the knowledge I have given you a little while ago, the generalities of spider. Please keep that image, those slides in your mind, and please try applying. Okay, so that was in general. Now we are talking of a particular spider, and this spider is Theridion. Whenever Theridion is thought of, first thing is its affinity for CNS. And if you recall, what did I tell you? Acting on CNS, what will the spiders generally do? Can somebody quickly think of? What will the spiders do acting on the nervous system? And which nerve specifically did I tell it acts? It acts mainly on the motor nerves. So you saw conversions, you saw that chorionic movements and all that. And I also told you in that lecture that there are few spiders which also acts on the sensory nerves. Okay, and this is one such spider which has an affinity for the sensory nerves. Especially, it will cause hypersensitivity to noise. So the nerve which is responsible for the noise, right? On that nerve you see pteridine acting, and it will cause hypersensitivity to noise. Okay, they're very sensitive to noise. That's what I also told in a case just before a few minutes. They're very sensitive to noise. What other remedies come to your mind when we talk of sensitive to noise? If you are quick, it will be easy for me to go ahead. Very good, beautiful. I like the quickness. I'm happy. Yeah, good. Hepar, Naxwamika, beautiful, good. See, there are many more remedies from your repertory which can cause sensitiveness to noise. They're very sensitive. Hepar is there. Yeah, somewhere it should be there. If it is not there, you please add Hepar. Naxwamika, you all know from your second year classes. Borax, Asaram. As you go higher in final year or in a PG, the list will definitely increase. Borax, more than 8 terms, I'll go for borax. Okay, and the other things. See, not only the nerves. If you also recall, Theridion is that spider which has an affinity for the bones. Bones, very good, correct, absolutely right, bones. So what will Theridion do acting on bones? Yeah, before I've asked the question, Sai is up with the answer. So it mainly causes caries, necrosis, caries of bones. I was reading Dr. Phatak's Materia Medica, beautiful Materia Medica. In that he says, a very prominent medicine for necrosis of bones. If any indicated remedy fails for different reason, Dr. Fatak says you can think of Theridion. Fine. So that is the kind of value Theridion carries when you talk of caries of bones. Again, a quick question: caries of bones. What are the remedies? What are the remedies? Yeah, very good. Asafoetida. Good, beautiful, agreed. Okay, fine. See, restox will not cause caries. You know, it's a very superficial remedy. Silesia, calcarea, good. Uh, Let me give you the list. I mean, uh, as you continue your journey with homeopathy, the remedy list will definitely increase. Good. Majority you are covered. Calcarea you are told. Meserium you are told. A lot of acids. Topping the list will be fluoric acid, which has a deep corrosive thing, very corrosive acid. It can cause caries. So pteridine acts on the CNS, the sensory part, and the bones. Two very important sphere of action. I hope it's clear. Now we'll quickly look at the ailments from. What are all the causative factors? Okay. Sea traveling. Slowly, when I tell you about the particular symptoms, you will realize Theridion is a very good remedy for seasickness. So sea traveling, or it could be washing clothes. Okay. Any other remedies? Washing clothes. Easy question. Washing clothes. Are you? Yeah, very good. Yeah, sepia. Good. Keep it up. Sepia. Laundry work. Sepia. Good. Now, what happens in Theridion? When they wash clothes, what happens? Again, Dr. Fatak has the answer for this. He says fainting from washing clothes. Okay. Only remedy you have in your materia medica, fainting from washing clothes. So seasickness, sea traveling, washing clothes, and riding. These are all the causative factors. Please understand any issues, feel free to get back. Now, because of the time, I may have to be a little fast. I'll try my best. 1 hour, I want to cover two small remedies. So please concentrate, focus. Any issues, kindly get back. So the remedy I have started is Theridion for students who have joined late. Two sphere of areas, two sphere of actions. One is CNS, the second thing is bones. We spoke of ailments from three ailments I gave you. One is riding in general riding, or it can be sea traveling, or it can be washing clothes. Now, what has banana got to do with Theridion? Can somebody quickly think of why bananas come up here? We have discussed this a little while ago. Why? Very good. Good. Beautiful. Keep it up. See, I'm happy because this is how I feel happy on an online medium. Fine. Very good. So, desires banana. Good. Very good. We discussed that. And not only banana, any other desires that you can recall? We just spoke. Very good. Desires oranges. Good. Beautiful. Good. So, desires oranges and desires sour fruits. Sour fruits. So one more thing that can come up here is gooseberries. Gooseberries. Desires gooseberries. See, desires sand was more of a general desires. That's more prominent in Tarentula. Now we are talking of Theridion. Okay, Theridion has desire for banana, oranges, gooseberries, wine, and sour fruits. Okay, these are all the desires in Theridion. We'll go ahead. Now, this is very important, which I hope you understand that what is this symptom that I'm trying to explain here? What is this? We just spoke. Yes, good. Sensitiveness to noise. Good, absolutely right, Sai. Sensitiveness to sound. They're very sensitive, hypersensitive. Now, why so much of stress is given in Pteridion related to noise is because they're so sensitive to noise, they feel that noise is penetrating their body. Especially they feel When somebody is talking, when some music is on, they feel that those sound waves are entering their teeth. Their sound waves are penetrating their body. This is the extent of sensitiveness you have in Theridion, and that's why it becomes very, very important. Okay, now sensitive to noise and even see the beauty, even that tickling. What is it that clock? No, that makes that sound, noise. No, that sound. Even to that sound, they are very, very sensitive. Okay. Can you quickly think of a remedy here? One single remedy. I don't want many. One remedy. Very good, beautiful. Padmini. Opium. Beautiful. No, nothing to comment. Opium. Good. So sensitiveness to noise. Noise penetrates their body. This is how you have to remember. Noise causes nausea. Noise causes vertigo. Very important. Going ahead, again, when you look at the mind of Theridion, which has plenty of things, I'll tell you what is relevant for a third year student. Time passes too quickly. Okay, I hope you understand this. Sometimes in some situations, you're with a girl, you're in a class, you're in some situations, you're in a movie, fine. You feel so fast interval came. Time will go in its own pace. This is our perception. So what is that perception a Theridion patient will have is time is passing too quickly. Fine. Some classes you'll be attending. Okay. Class starts at 12 and you'll not realize when it became 1 o'clock. And when you have that bell, school bell or college bell, then you realize, boss, how did this 1 hour fly? Fine. So this is what we call it as time passes quickly. Okay. Similarly, we have exactly opposite scenario wherein a patient feels time is passing too slow. Class would have started at 12, and after 10 minutes you'll be looking, oh, it's only 10 minutes. Fine. Meaning it is going slow. You feel the time is passing slow. And one beautiful remedy, as a third year student, you should be aware of, yes, you got it right, alumina. In alumina, time passes too slowly. Many more remedies are there. As you grow, we'll increase the list. Time passes too quickly is cocculus. Please do have this in your mind. Cocculus is also a remedy. We are discussing about Theridion. Theridion. Okay. Yeah, cocculus is also a remedy. Very timid constitution. In the previous slide, we are talking of sensitivity to noise. Here, noise in the mind, you see, it will cause startling. In our local language, we say "becchi bilodu," startling, startling from noise. That's also there in Theridion. Okay. And there are a lot of confusions, fine. And generally even the mind of pteridine is not very sharp like other spiders. There will be a lot of dullness, there will be a lot of confusion. Okay, because of the time I'm limiting the mind of pteridine, but I've given you the important point. Time passes too quickly, lot of confusion, fine. And very timid, startling noise from, and again a lot of slowness, dullness. They will have confusion in taking decisions. Generally they leave decisions to others, let them take, and they just follow them. Okay, now this we have already spoken, but I again want to highlight here is caries. Caries of all bones. There is pain in bones, as if that part would fall off, as if broken down from head to foot. This is the subjective feeling what a pterygium patient has. Okay. Caries, please remember pterygium in caries. Generally, we give silicia, we give meserium, we give fluoric acid, but pterygium is also a remedy that you need to remember. When you look at the particular symptoms, beautiful remedy for vertigo. I already shared a point. Noise causes vertigo. What is it? Noise causes vertigo. Vertigo while in sea, like for example, is on sea, is on a boat, he can have vertigo. So vertigo, what exactly happens here is vertigo associated with nausea. Hmm. Other remedies, vertigo on closing eyes. Again, we have lacasis to top the list. Vertigo on closing eyes, lacasis, fine. And vertigo on driving, which we just saw. And vertigo walking. So these are few triggers for vertigo. Vertigo associated with nausea. Okay. And I've given you few more remedies which you can make a note. When time permits, we'll discuss in detail. Okay. So not only vertigo, you also have a very important symptom related to nose in Theridion. See, we were talking of spiders being predominantly psychosyphilitic. So when I say symptoms related to nose, we are not bothered about coryza and cold. We see something which is more syphilitic. And what is that we have syphilitic here is ozina, wherein you have crust in the nose, and when you remove that crust, it will cause bad odor. We call it as ozina. Atrophic rhinitis. You know, you have got bad discharge and very bad crust getting formed. So ozina and yellowish crust. You have the other discharges, other remedies I mentioned. Yes, offensive discharges, yellowish, greenish discharges, coming from the nose, crust getting formed. Again, I was talking to you about tooth. What was that symptom I just shared with you related to, the symptom related to teeth? What happens to the teeth? They are so sensitive to the sound that sound waves are penetrating the teeth. That is one symptom. And again, it can be a very good remedy for toothache. Okay. Yeah, this sound waves penetrating the teeth. This is something which is very characteristic. Okay. So we'll go ahead. So that was related to teeth, and we have other remedies I have given you here from the source books from your repertories. Coffea, Tarentula, and Calcarea. These are other three remedies which can also be sensitive to noise and noise penetrating the teeth. Very good remedy for seasickness. Okay, hope I'm right. Yeah, seasickness. So when they land up with headaches, when they land up with vomiting, see, traveling through the medium of sea is very rare these days. But if you look during honeymoon's time, sea traveling was very often used. Now we go out for pleasure, but then they used to travel through the sea route. So, lot of remedies we have in our homeopathic materia medica, which was used and which we still use for seasickness. One is Theridion. Can you think of any other remedies? As a third year student, I always keep telling you that as a third year student, can you think of any other remedies? Good tobacco. Yes, good tobacco. Absolutely right. Okay, chalo. So we'll go ahead and seasickness, other remedies. Seasickness better by taking anything hot or warm. They have this nausea, they have this headache when they are traveling in sea, and if they drink something hot, they feel better. That is pteridium. And again, very important remedy for pain. Pain in left floating rib. You see that area that I mentioned there? Pain in left floating rib, pteridium. And the other remedy is petroleum. Okay. So this is again a very important thing you have in uh, Theridion. Now, if you see the way how this gentleman is sitting, this is where an image can tell you so many things thanks to Google Images. Now, what you need to understand here is this is how a Theridion patient will be sitting. Now, if you try to understand why Theridion is taking this particular posture, you'll realize that the pain in back, fine, is they're very, very sensitive. The vertebrae, they're very, very sensitive, and patient tries to avoid his spine coming against the pressure of the chair. So he either sits sideways or he tries avoiding putting pressure on his back. Now, if you get such patients, you know, I mean, it's a beautiful thing that you should not forget. The remedy that should come to your mind is Theridion. Okay, when they say, "Sir, my back is aching so much that I can't sit behind, I can't support my back against the chair," fine, that is Theridion. Please don't forget. Okay, so this is related to back and sleep. We already discussed in many spider remedies. Sleeplessness. See, the speciality of Theridion is, in spite of he being exhausted, he doesn't feel sleepy. That is very, very characteristic in Theridion. So moving ahead, sleep disturbed by slight noise. Slight noise disturbs the sleep. Again, you can think of Theridion. Yeah, better remedies. Opium stands the list. Somewhere somebody is making noise. Opium gets disturbed. Asaram, coffea, nux, selenium, sulfur, or the other set of remedies you need to remember. Sleeplessness. So, Theridion, a very important remedy you need to understand. Main action will be on the bones and of course on the nervous system. The sensitiveness to noise that carries on the bones, and that specific desires, banana, orange, or sour fruits, and going down, it can cause vertigo. Just from head to toe, you try to understand. It can cause ozina, right? Seasickness, okay, and the sensitiveness to sensitiveness of spine, the vertebrae, okay, and sleeplessness, and one spider which has less sexual desire is Theridia. I was trying to tell you, spiders generally have increased sexual desire, nymphomania. But one spider which has less sexual desire is Theridium. Okay. So, any questions related to Theridium? See, if Theridium is clear, I'll just take another 10 minutes and we'll try to focus on Tarentula cubensis. Uh, Hispanica would have been a beautiful remedy to teach because you have got so much to learn in Hispanica. I would have loved, but we'll see. Must be some other day, some other platform. We'll try to explore Hispanica. Beautiful remedy, hyper kids. But what is there in your syllabus is Tarantula cubensis. Okay. Now, from what we already spoke about spiders, what are all the points that you can recall related to Tarantula cubensis? What information can you think of, you know, from the previous class? What is Tarantula cubensis all about? What is the sphere of action? At least, yeah, I'm specifically talking of Tarantula cubensis. If you could recall the previous class, Tarantula predominantly acts on which part? Okay, not nerves. No problem, not nerves. Not nerves. No issues. Yeah, very good. Who's that? Blood. Pujita. Yeah, good. Blood. And what exactly Tarantula does? Tarantula cubensis, I repeat, cubensis does acting on blood is it will cause blood poisoning. Very good, absolutely right. Blood poisoning and septicemia. Okay, so a spider which predominantly acts on blood, which predominantly acts on the cellular tissue, is Tarantula cubensis. Okay. And what was something characteristic about Tarantula cubensis? Can somebody quickly recall? Okay, no, not Korea, no problem. You only put a question mark, nothing to worry. It's not about Korea. We were also talking about one more point. Thermally hot spider, Tarantula cubensis. Okay, thermally they're hot. Okay, we'll continue. So, as I told you, it's a small paragraph which I've taken from the source book. Okay, the side affinity, good, agreed. Mainly acting on the cellular tissue and blood. I'm directly giving the symptoms. Here again, I'd like to share a small case. One of my assistant doctor had shared a case of an abscess. I just checked for the photo, and this abscess, if you look at the photo, it is got a kind of a purplish hue. The abscess looks, it's got a tinge of purple color. I was very lucky in my practice of 25 years, never had seen a case of an abscess with a purplish hue. Though I have learned, though I have taught students, I never got an opportunity to see an abscess with a purplish hue. That way I'm lucky. And when you see an abscess with either a purplish or a bluish thing, one remedy that should come to your mind, and that remedy is Tarentula cubensis. So a very important remedy for abscess. And abscess again, you'll have a lot of remedies coming to your mind. So to clear that confusion, when will you think of Tarantula cubensis in abscess is again very important. Abscess which burns, abscess which is painful, which has a purplish hue, only remedy in your materia medica, which has a purplish hue, that is Tarantula cubensis. Stabbing, stinging pains, abscess which tends to be gangrenous. Must be some other slide I would have mentioned. Malignant abscess, abscess which is bluish. Okay, in brackets you can have Tarantula hispanica and also lacasis. Okay, carbuncle. As a third year student, you would have seen in the allopathic postings that you were posted. They generally surgically drain out the abscess or they surgically drain out the carbuncle. So without the need for a scalpel, if a homeopathic remedy is indicated correctly, abscess carbuncles can be beautifully cured. Anthrax, arsenic, Silesia, HEPA, a lot of remedies, but they do wonders. Calcarea sulf, lot of remedies. But when Tarantula cubensis, that is very important. When it burns, when it is painful, bluish or a purplish discoloration, that's the solid indication for Tarantula cubensis. Carbuncles, okay, and moving ahead, related to the skin, you also see this being a very important remedy for phelon. In local language, ugur suttu anti ನಾವು. This you study in your third year surgical surgery classes. Phelon, very painful condition. Okay, and senile gangrene, ulcers. Okay, wounds which comes from poisonous animals, bite of a poisonous animal, bite of a spider. You can think of Tarantula cubensis. See, when this bite of a poisonous animal, poisonous spider, when that affects the cellular tissue or the blood, and then they go into septicemia, that is where Tarantula cubensis will come into picture. Okay, cancer of breast. These are all the indications of Tarantula. Few images. If you can see that purplish thing, carbuncle. You have an image here. Okay, and yeah, bad pains. They can't bear pains. Hmm? Burning pains, stinging pains. Please do think of Tarantula cubensis. Okay. Yeah, abscess which burns. Two more remedies. Anthrax, arsenicum album. There is some error with the spelling. Kindly correct. Ars alb, ALB. I've written ars as twice. Okay. And Tarentula hispanica. Sorry, Tarentula cubensis. Only three remedies. Burning pains in our repertory, which is given 3 marks. Okay. So, pyro, lacasis, silesia. Yeah, this is what I was trying to tell you. Carbuncle, spot diagnosis, carbuncle, beautiful remedy. Okay. I was talking to you about senile ulcers. If you look at your left, there is an image. Senile ulcers. Okay. You can think of Tarantula cubensis. So it's gangrene. 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 Recently, we had a nice case of one of our patient. She had gangrene of finger. Tried with lot of remedies. I mean, two remedies you have in the materia medica. Gangrene of finger is sickle corn and plumbum. I did not get her case completely, so blindly, I know it's a mistake. I'm telling you my mistake openly so that you don't commit the same mistake. So I did not take the case. I gave her sickle. Nothing worked. It came to the extent that the surgeon told next week we'll have to amputate a part of your finger because it's turned black, it's turned gangrenous. Again, this happened over phone, and again we sat with the patient, we understood the patient, why she is going into gangrene, etc., etc. And then she was prescribed sepia. And after sepia, she's in touch with the surgeon. She's been going for regular dressings and all. The surgeon was shocked. The finger has beautifully healed. I have the image. I'll take the permission from the patient and I'll share. But what I wanted to try to tell you is this science homeopathy is beautiful. Never go for shortcuts. Understand the person. Base your prescription on homeopathic principles and they do wonders. So today after sepia, which I have repeated often as a gangrene case, I did not give a single dose. I had to repeat very often. But the beauty is we could save the finger from amputation. It gives a lot of satisfaction. Okay. So gangrene, carbuncle, fine. Now I was reading Dr. Borik's Materia Medica, beautiful book. There, Dr. Borik, in his introduction, he says, remedy for pain of death soothes the last struggle. Indirectly, what he's trying to tell you is Tarentula cubensis is a very important remedy for euthanasia. I was checking in the repertory. Euthanasia, you have Tarentula, which is mentioned, Tarentula hispanica and Tarentula cubensis. So, homeopathic remedies for euthanasia, amyl nitrosum, antimtat, when the person wants to mercifully kill himself, relieve himself because of respiratory complaints. He's got some respiratory complaints and then he wants to relieve himself, relieve himself from pain, that respiratory suffering. The only remedy we have is antimonium tartaricum. Arsenic, carbonates, lacasis, phosphorus, and you see those two spiders mentioned in our repertory, euthanasia. And last thing about tarantula here is malignant abscess. See, generally the potency, see, I mean, it is illegal. So honestly, as a doctor, our duty is to, what, extend life, fine. And euthanasia is not legal, especially in India. I don't know about other places. So I never used these remedies in patients, fine. So sorry, I can't tell you the potency because this is not our what our sole aim. Our sole aim is to prolong life. But unfortunately, at least here, I know many patients come, sir, I'm fed up of suffering. You please relieve me. Fine. But as a what preserver of health, We have no rights to put an end to somebody's life. Okay, at least we don't do that. Fine. It is there. Must be abroad they use. I have no idea. Abscess, malignant abscess. Only remedy is Tarantula cubensis. Abscess I already discussed, having bluish hue. Tarantula hispanica and lacasis. And abscess which will have a purplish discoloration is Tarantula cubensis and Tarantula cubensis, only Tarantula cubensis. Okay, so this is related to Tarantula cubensis and Theridion. If you have any quick doubts, please feel free. Next class, I'll start with either Merck group or carbon group. I need to prepare. Hopefully, I'll keep you informed when the class will be. We'll talk of carbons because carbons we have carbobage and petroleum or graphites. I don't know. Some 2 3 remedies we have. So that once I do carbons, I can finish off those remedies also. Okay. Any questions? Okay. So we had back-to-back classes. If there are no questions, please go through the notes or the images, the photos that you have taken. Kindly go through. If you have any questions, you can always get back. Okay. Thank you for joining and have a nice day and best wishes for your exams. Thank you.